Hi, I'm talking today with Sharon Ron. Sharon is a speech and language pathologist at the Maytab Center. Hi, Sharon, how are you?
Great, thanks.
Sharon, let's talk about stuttering. What is stuttering?
Stuttering is basically when someone has more than the normal amount of stops in their speech. The stuttering behaviors are basically broken into two parts. There's the core behaviors. The core behaviors are the actual stutters in speech. Those are repetitions, prolongations, and blocks. And then there's the secondary behaviors, which usually come as a reaction that the stutterer would have to being caught in the middle of a repetition, prolongation, or block. These are also broken into two parts. There's the escape behaviors, meaning I'm stuck in the middle of a stutter. What am I going to do to get out of it? So I may have some physical behaviors, like I may squeeze my fists, or I may close my eyes tight or blink them or make head nods or that kind of thing. That's an escape behavior. Or there's avoidance behaviors, meaning I feel that a stutter is about to come on. I don't want that to happen. I may switch words. I may postpone what I'm going to say by using interjections like, things like that. Or I may do other kinds of tricks in order to avoid. I may use a fake accent. I love your accent. I may use a fake accent to get out of the stutter that I anticipate coming. So there's the core behaviors of the stutter themselves, and then there's the reactions to that or the anticipation of that would cause secondary behaviors. That's basically, in a nutshell, what stuttering is.
What causes the stuttering?
I knew you were going to ask that. That's a really complicated question. There's a lot of different factors that influence what causes stuttering. One part is certainly a neurophysiological part, meaning the congenital component. If my dad stuttered, or if my mom stuttered, or even my aunt or my brother, there's a higher chance that I may stutter. Your wiring in your brain, most people are left brain dominant for language. And some people who have right brain dominance or an overaction on the right side of their brain when they speak may be more prone either to beginning to stutter or to continuing to stutter. I want to say at this point that also about 50 to 80% of people who stutter when they're young, and stuttering begins usually between the ages of 2 and 5 years old when you're really young, but about 50 to 80% of those people actually recover spontaneously with no need for therapy at all. So there's certain factors that would make you either more likely to begin stuttering or to not get over stuttering spontaneously and need therapy. Another factor that's involved in starting stuttering is that there's many more boys than girls who stutter. So if you've got a family member who stutters and you're right brain dominant and you're a boy, there's a much higher chance that you're going to stutter than, your counterpart friend who's a girl who doesn't have anybody in their family who stutters. It's usually in childhood about 4 boys to 1 girl who stutter. And by the time you become an adult, about 3 boys to 1 girl, because there's a lot of spontaneous recovery. But overall, the amount of people in the population who stutter is about 1%, so maybe not as much as you thought.
If you've been stuttering since a child and you're now into your adulthood and you haven't stopped stuttering, is it possible to be treated?
Absolutely, and we work only with adults. The youngest people that we ever tend to see are about 15 or 18 years old, and we do get adult stutterers who have stuttered all their life, and they may have had therapy as kids. Actually, we had somebody who never had therapy who's in their 30s and just sort of walked in, but usually we have people who have tried and they haven't gotten it to work for them, and it's definitely worth a try. There's no guarantee that somebody who comes in who's a severe stutterer as an adult will completely get rid of their stutter, but we can certainly help them make their stutter lighter, easier, better to live with. We actually had a patient about 1.5 years ago who was 91 years old, who I guess on his bucket list was get rid of his damn stutter, and he came in and we did therapy, and he did fantastically well. It was just a pleasure to work with him, and he said all his life had held him back, and now he had time and he did fantastically well. Yes, I would definitely say that as an adult, it's worth it to come, even if you've had therapy before and it hasn't worked for you. We had a big rush of people after the King's Speech movie came out. Then we had a bunch of people calling and saying, hey, do that for me. And it was great. It was fantastic.
So what are some of the techniques you do when trying to treat an adult for stuttering?
Okay, there's two basic schools of thought in therapy for stuttering, and they're pretty different. One is fluency shaping and one is stuttering modification. In fluency shaping, the therapist takes the smallest little tiny bit of speech that the patient can get fluently, and then they try to build on it. It's very, very hierarchical. You can do maybe one syllable, then two syllables, then a word, then two words, and you don't proceed until you've really, really gotten that level sounding great. And then you try to make the speech sound more natural, and you use it in different contexts. But basically, they try to alter the speech by changing the rate or changing how you move your lips, like making light contacts with your tongue, with your lips, changing the way you use your voice, and you basically build on incremental increases in fluency. That's fluency shaping. Also in fluency shaping, they don't deal at all zero with the emotional aspect of stuttering, this anticipation, avoidance, this fear, all those horrible feelings involved. The other school of thought, which is pretty different from it, is stuttering modification, where you try to help the stutterer stutter more easily. So, for example, if I said something like that, like the stutter that I just did for you there, I didn't have any tension. I didn't feel horrible about it, as opposed to if I said something like that, you see that I'm tense, you see that I'm feeling awful about it, that I just want to get out of it. Maybe you're uncomfortable listening to it. So stuttering modification is helping the stutterer stutter in a lighter, easier way that just doesn't bother them. In stuttering modification, you really, really, really address these emotional aspects, the fear that goes along with stuttering, the avoidance, the social issues, and you really work a lot on that. I work a lot more with stuttering modification also because I work with adults who, after carrying around the stutter with them for maybe 20 years, they've got this emotional issue that they've sort of got to get past before they can move on. But having said that there's these two schools, there's a billion different approaches that go within those. There's also approaches that don't deal with those, and there's an integrated approach, but those are the two main, schools of thought.
Thank you, Sharon. Thank you so much for talking to me.
My pleasure. Thanks.